And I call Mr. Chris Lyttle.
Thank you, Mr. Speaker, and I welcome this overdue action today and to pay tribute to all those who have been involved in the campaign for equal access to cancer drugs in Northern Ireland, including Cancer Focus. And I hope also that this demonstrates a departure for the DUP from political campaigning against responsible, fair revenue raising as a way to fund essential services, and I welcome the leadership that has been shown by the Minister to that regard. I'd like to scrutinise his dismissal of pharmaceutical price regulation scheme as an option a little further. He said in his statement that at this stage he can't be definitive about the scale of payments, and he's gone on to detail those, and indeed in an answer to a question to me he detailed receipt of around £3 million by the Health and Social Care Board in June 2014. So could I ask the Minister to again state why the pharmaceutical price regulation scheme has not been used for Northern Ireland Cancer Drug Fund or Specialist Medicine Fund as per Scotland, and what it is being used on instead, rather than to achieve equal access to cancer drugs for cancer patients in Northern Ireland?
I think it's important, first of all, Mr McAllister's question was dated for answer for the 18th of February, so it literally is hot off the press, as it were. So he no doubt will use that against me in the local press, that he was on the ball, as it were. But could I just say that we need to understand the PPRS system. It's based on a refund to the department based on receipts of drug expenditure actually undertaken. So therefore, to some extent, it is difficult to predict exactly how much is going to come in. It always comes in retrospectively. We only introduced the PPRS scheme in Northern Ireland on the 1st of January 2014. And whilst we very much welcome it, it is still in its infancy. But he needs to understand that that income, which could be, according to Mr McAllister's answer, £13 million, you need to understand that that's in the context of £165 million that I need to find to deal with financial pressures in 15-16. And the point I made earlier, that we are already committed to spending £12 million in increased budget for pharmacy, simply to take cognizance of decisions made by NICE in London. So therefore, we're not in a position yet to be definitive, but it's pretty clear that we're running fast to keep still. That will not provide us with the additional money that we need to do what we should do, and that's to offer hope to many cancer patients and other patients. Keep remembering, this is beyond cancer. There are other life-threatening conditions in Northern Ireland who also require these specialist treatments. And I know he has written to me on several occasions on behalf of his constituents on these issues, as has almost every member of this House and MPs. So therefore, the sums clearly indicate to me that the PPRS is useful, but is not going to meet the ultimate need that we require. And I welcome his support for some form of additional charge for prescriptions. And I want to see a debate. I want to see the Health Committee and I want to see this Assembly debate this issue and come to a thought-out view on it, because at the end of the day I'm going to need that support, because of the system we have here in the Assembly means that things can be stopped very quickly if they don't have cross-party support.